Hi, in this video I'm going to demonstrate how to do a wound dressing change using the sterile technique. So the first thing that we want to do is check a physician's order. And we are doing a dressing change on our patient's left thigh laceration, and we have to change it twice a day, and as needed, we're going to cleanse with a normal saline solution and then pack the wound with a normal saline soaked 4x4 gauze. We're going to cover it with another 4x4 gauze and an abdominal pad, and we're going to secure that with a knee fit. And then we also want to check our patient's chart for any pertinent information, so we know that our patient has been admitted for a left thigh laceration. And then I'm just going to copy our patient's information onto our worksheets to have something to check to make sure that we have the right patient. So I'll write down their name and their date of birth. Lucy Maragamo. Date of birth, February 16, 1997. So before we head into our patient's room, we want to gather all of our supplies, which I already did. And then we're going to knock and introduce ourselves and do a quick bedside safety check. Make sure the bed is in the lowest position, side rails are up, our patient is not in any form of distress, and their call is within reach. So we'll head into our patient's room now. So I'm going to knock and doing that general survey safety check that I mentioned. And then we want to introduce ourselves to our patient. Hi there, my name is Alex Cruz. I'm a year 2 student nurse at the University of Manitoba. I'm here to take care of you today. Can you please tell me your name and date of birth? So while we're checking our worksheet, we want to have them verbalize their name and check their name band. Okay, so I'm just going to lift your blanket, and can you please tell me your name and date of birth? Lucy Maragamo, date of birth February 16, 1957. Okay, that's what I have here. And do you also have any allergies? No, you don't? Okay. So we want to explain the procedure to our patient. So, Ms. Maragamo, we're going to change your dressing on your left side. So what I'll do is I'll take out the old dressing and assess it for any drainage. And then I'm going to clean the wound and assess the wound for any signs and symptoms of infection. Make sure the wound bed is healing normally. And then I'm going to cover it up with a new dressing. Does that sound like a good plan to you? Our patient gave us consent. And do you need any pain medication for the procedure? No, you don't? Okay, so our patient doesn't need any pain medication. So before I get started, I'm going to raise the bed to a good working height, okay? So we'll raise the bed to a good working height. Okay, that's good. So Ms. Maragamo, I'm just going to get my supplies ready here, okay? So, we want to do hand hygiene. And put on a set of gloves.
So if there's a little bit of water inside, that's okay. If it was like cooling a lot, then I would want to
Okay, so I'm just gonna expose your leg so we can check the wound. So I'm gonna take off the old dressing now. We wanna loosen up the edges of the tape gently. And then we want to remove the old dressing, and then we want to assess the amount of exudate, the color, as well as if there's any odor. So if there's no foul odor, it looks like it's saturated 100% of the wound packing, so that's 100% saturated 4x4, as well as another 2 wound cover. There's 2 4x4, so 100% saturated with serosanguinous exudate, and then it looks like it also shadowed through the abdominal pad, so about 20%. So we'll just throw this into our garbage and change our gloves right away, and then do another hand hygiene. Okay, so Ms. Maragamo, I'm just going to set up my sterile dressing tray. We're going to open up our sterile dressing tray, making sure we're only touching the 1-inch border. And we have our forceps underneath. And then we have our garbage bag. So I'll just pass that on to myself and set it up on our patient's bedside. And then we have a drape that we can put on our patient's
A
leg.
little bit better if I want the patient to sit a little bit or have like a little bit of weight to having the risk of it falling out. But otherwise, it's good. So I'm just going to do garbage.
And then I'm gonna set up my forceps.
I would say that I would just work with
So then now I'm gonna open up my Cathlon. And then I'm gonna remove the cap. And then we're gonna drop that into our sterile dressing tray, and this will go into the sharps disposal. And then next thing I want to do is when I open up my syringe.
and then peel it open, and then go again, around the peel on the inside, and then wrapping it.
And I'm also gonna need some cotton tape, swabs.
Patient, I can grab
And I'll open up another one. And I'm going to pour normal saline solution. So we check that it's not expired yet. I'm gonna put the normal saline onto our dressing tray.
So for the sake of the video, I'm only going to do tape, but in other cases I would be securing.
Okay, so we're gonna do hand hygiene and put on a set of gloves.
Discard my contacts into the garbage. I'm going to be putting I'm going to like this. How are you feeling? Okay, she's feeling okay.
And we're gonna draw up our solution. So we wanna draw 30 ml.
And then what I'm going to do is
And then we're gonna connect our Cathlon onto our syringe.
I'll be putting up 3 of the bed rails. I'll keep this one.
And then we're ready to irrigate the wound.
I'm also going to,
So I'm gonna clean the wound now.
well, before I'm leaving,
And we wanna stay about 10 centimeters away from the wound to give us enough pressure to clean the wound without injuring the healing tissue on our patient's wound bed.
Make sure the patient is not in distress and that they're not hazardous stuff like that.
so I'm going to assume that that's in that position and that my patient is feeling okay. And then again, I'm going to be documenting.
So we'll just toss that into the garbage, and then we're gonna dry the peri wound. So we're gonna form a rosette using our 2x2 gauze, and then dry the wound using the one swipe or wipe method.
Stating that we'll continue monitoring for additional I will be meeting with the committee for like so starting that again. I know so this is just 24 hours. I think I'm maintaining this so I can provide that information, but I'm just gonna that is
Now that the wound is dry, we can assess it. So we wanna take note if there's any tunneling or undermining. So we wanna start in the direction of our patient's head and move clockwise. So we're assessing for tunneling or undermining. and there is none. And then we want to measure the wound. So we're gonna measure the length, the width, and the depth. So we're gonna measure the length of the wound. So that is about 11 centimeters, and then the depth, sorry, the width is the widest part. So that is about 2.5 centimeters, and then we want to measure from the deepest part of the wound bed for the depth. So that is about 1 centimeter. So this will just go into the garbage, and then now we're ready to pack our patient's wound. Before I do that, we want to assess also the wound bed tissue, and then we want to take note of the wound margin, if there's any odor present, the exudate, if there is any, and then we want to assess the peri-wound skin, make sure there's no skin breakdown. So then now I'm going to pack the wound with a normal saline soap 4x4. So I'm just going to open up our 4x4 dressing and dip that onto our solution. And I'm just going to wring out the excess, making sure that the forceps stays down. I'm just gonna wring that out one more time. Okay, so now we're gonna pack the wound with a Q-tip. So we want to make sure that the packing does not, or as much as you can, it doesn't touch the wound edges, and then you want to make sure that we spread out the packing evenly.
So position this way. Okay, position this way when I take one. Position a little bit like this when I'm irrigating.
Okay, that's good. And then we'll throw this into the garbage. And then we're gonna cover the wound with another 4x4 gauze as per order.
Yes, I agree. The other ones are easier to dry with. It's just because the wound I was using at home.
So our order stated just one 4x4 gauze. And then we can cover up the wound with an abdominal pad. So this one, we want to make sure we're only touching the outside. And we're going to put that onto our, cover the wound with the abdominal pad. You're just going to move your leg here so that it doesn't fall off. Okay. And then we want to remove our gloves before we put our tape to make things easier for us. We're going to do another hand hygiene. And then we're going to cover with a Mefix.
And then so I can take the garbage bag, have it to myself, and take this down. And place nearby.
Right.
So now I'm going to
Okay, there we go. So for the purposes of this video, we are just putting one, but we want to make sure the whole abdomen or the sides of the abdominal pad are all covered with Mefix. And then we're just gonna clean up all of our supplies, and then throw it in the garbage. Make sure our patient is comfortable before we leave them. So the wound dressing change is now done, and you did very well. We want to make sure that their bed is in the lowest position, and that their side call bell is within reach, and their side rails are up, and that make sure that they are comfortable. So I'll just remove this, throw it in the garbage, and then before we exit, we want to do a safety check, general survey, and then we want to document all of our assessment findings onto our worksheet, into the patient's chart. So we will note our assessment of the old dressing that we removed, as well as our assessment after we've cleaned the wound. We want to make sure document our patient's tolerance during the dressing change, as well as our plan. So our plan is to change it later again today, but to keep assessing it if it needs to be changed earlier than that. So that is it. Thank you.